Have you been struggling with dry eyes? Have you wondered how to get rid of the bags under your eyes, maybe, or dark circles? Worried about glaucoma, cataracts, retinal tears, anything going on? We need our eyes for vitality. And this is such an important conversation that I'm sharing with you today. It originated from a special conversation in a live community call in my Girlfriend Doctor Club community. My dear colleague, she lives in New York and she's an ophthalmologist and she is really the eye expert. Dr. Rani and I sat down with this incredible group of women in my community to talk about health, hormones, and powerful ways that we can really enhance our eye health. We need our eyes for our vitality, and it's key. In this episode, we hit um, really a plethora of practical tips and strategies and insights that I know will inspire you. You will have a new eye routine at the end of this podcast. So be sure to definitely check this out. Listen carefully, have a pen and paper ready, get your mighty maca to sip along the journey and feel, and you will feel the difference from this conversation. You will feel more empowered. There is hope. We can reverse age our eyes. We can go a long way to reversing dry eyes. And I know you're going to enjoy this conversation. So here, let me introduce you to Dr. Rani Banik. Tell us a little bit about your background.
Sure. I am based in New York City. For much of my career, I was in academic medicine, and I still have an appointment in academic medicine. But about 8 years ago, I realized the benefits of integrative and functional health. And so I ended up pursuing that. I got certified in functional medicine. And now what I do is I apply a lot of root cause medicine to vision issues. I still, again, I have an academic appointment. I still teach, but I have a private practice based in New York City. My goal is to really raise awareness of what people can do proactively to preserve their vision, because a lot of us take our eyes for granted. We don't really think about our vision. We just assume that we'll wake up and be able to see. But unfortunately, things happen as we get older. And the good news is, we can counteract a lot of these changes that happen with our eyes, whether it's having to have reading glasses, whether it's dry eye, whether it's developing cataract. There are so many things people can do to manage these issues and still see like clearly and confidently. So that's really what I do right now.
That's powerful. And when we talk about, okay, preserving and, optimizing our eyes to keep them healthy, what is your approach to that?
Yeah, now that I'm trained in functional medicine, I really think the foundation is nutrition. That's based off of what I've done, my own readings. I was never taught this, and never in I'm sure similar to many other doctors, that we don't get formal nutrition training. But this is something I've researched, and there's quite a bit out there about specific nutrients for eye health and how to use the power of bioflavonoids, which come from plants, to counteract oxidative stress and, again, preserve vision, fighting against a lot of the leading causes of blindness, which include cataracts, glaucoma, diabetic retinopathy, and macular degeneration. So food is really the foundation. But then on top of that, there are so many other aspects of health that are, again, within our control that we can optimize for our eyes. And that pertains to, we're on screens all day long. So how does all this screen time impact our vision? How do our stress levels impact our vision? Our other lifestyle choices? What potential toxins are we exposed to? So I really try to bring it all together for my patients, have a more holistic view of the eyes, because again, we take our eyes for granted. There are so many things we could do to optimize them, but also our eye health is so intimately connected with our overall health, our cardiometabolic health, our immune system health, our gut health. And so I really try to bring it all together when I advise my patients to do certain strategies for their vision.
So when you think about the foundations of nutrients for eye health and bioflavonoids, we always think of vitamin A in the eyes. And there's so many types of vitamin A. Which types do you recommend, and what other nutrients do you recommend for the eyes?
So vitamin A is really important, and that's why carrots got to be so well known for eye health. There are different forms of vitamin A, but I would actually say, Dr. Anna, that more than vitamin A, the most important nutrients for our eyes are the macular carotenoids. Now, these are cousins to vitamin A and beta carotene. They're in that same family of carotenoids, but these are macular carotenoids, meaning that they get absorbed by the body and put in the back of the eyes. The body preferentially deposits these nutrients into the back of the eyes to protect us. And these nutrients have specific names. You may have heard of them: lutein and zeaxanthin. And I know they're kind of hard to remember, hard to pronounce, but these are the macular carotenoids. There's a third one as well called mesozeaxanthin. So there are three of them. And they get deposited right at the center of the retina. And the center of the retina is called the macula, and that's what is responsible for our 20/20 vision. So, really, to protect your eye health, and I hate to say this, but more than carrots, more than beta carotene, more than vitamin A, you need to get the macular carotenoids through diet. And if you're not getting them through diet, take an eye health supplement. I tell all my patients that. Strive for diet first because that's the way nature intended. That's the way these nutrients get best absorbed. But then beyond that, fill in the gaps with supplementation.
What are some of these eye superfoods?
Yeah, so I would say number one, two, and three are leafy greens, leafy greens, leafy greens. Kale is the king when it comes to eye health because not only does it have the macular carotenoids, lutein, zeaxanthin, it also has vitamin A. It also has many other minerals our eyes need to stay healthy. Um, and then spinach, and then arugula or romaine lettuce. Those are kind of the top leafy greens. But many people can't have leafy greens. They don't tolerate them well. Maybe they have an oxalate sensitivity. So the good news is there are other foods that can also provide these macular carotenoids. So if you eat eggs, never throw away the yolk because that beautiful orange yellow color of the yolk is because of these macular carotenoids, lutein and zeaxanthin. So egg yolk is a great source. Also, this is really interesting. Peppers, bell peppers, many people kind of gravitate towards the green ones or the red ones because they're most commonly available at the grocery store, at the farmer's market. But I would say if you're getting bell peppers, if you're buying them and cooking with them, strive for the orange or yellow ones. So orange and yellow is the theme. If you try to include foods that are orange and yellow, you'll probably be getting a good amount of these macular carotenoids and vitamin A as well. So you're kind of covering all your bases there with those nutrients. And then there are also some other foods like spices, for example. Many people don't realize that some spices actually have high levels of the macular carotenoids, like, for example, paprika or cayenne pepper. So try to sprinkle in some spices into your cooking, into your soups, or whatever it is that you're making, and you get those eye health benefits. Um, I have my book behind me and it's called Beyond Carrots. And so you can find out a lot more about nutrition and some of these great foods, not just carrots, but over 40 foods that you can use to support your eyes.
And what about turmeric? Is that great for your eyes?
Yes, it is actually one of the therapeutic foods in my book. There's a lot done with turmeric and eye health. So there are studies to show that it helps with dry eye. It helps with cataracts. It helps with macular degeneration. So all of the big categories of eye disease, turmeric has been shown to help with. And it's mainly because it's anti-inflammatory. It has components that are also antioxidants. So all of these work together to promote eye health.
And you had said that looking at someone's eyes, right? Eye health is goes hand in hand with cardiovascular health. And we think about eyes, we think about diabetic retinopathy, glaucoma, and worry about those things. What is the connection first? And we'll get into dry eyes for everyone listening. We definitely will. What is the connection with, like, how do you look at the eyes as an early indicator or a result of cardiovascular disease? What's happening there also with diabetes?
I'm so glad you asked this question, Dr. Anna, because a lot of people, we've probably heard the saying, the eyes are a window to your soul. Well, in reality, the eyes are a window to your overall systemic health. We can, based on an eye exam, we can pick up so many changes inside the eye, around the eye, that may help us to a diagnosis of systemic disease. And cardiovascular disease is one of the biggest groups of conditions that we can diagnose simply based on an eye exam. So I can tell you that low blood pressure sometimes we can pick up based off of changes in the blood vessels in the retina.
With eye disease, looking in the eye, beyond being a window to your soul, it's a window to your health.
Yes, yes. So the blood vessels in the retina are a direct reflection of what's going on in the blood vessels in the rest of your body. These are small vessels, also capillaries, so they easily get damaged. And so if someone has, for example, high blood pressure that's not well controlled, we will see changes in the retinal vessels. So we can diagnose it that way. You mentioned earlier diabetes. Diabetes also causes a lot of changes, unfortunately, in the retina, where the blood vessels, the tiny little capillaries in the back of the eye, start to leak out fluid and blood and lipids, proteins. I like to call diabetic retinopathy a type of leaky eye syndrome. Many people have heard of, leaky gut, leaky brain, leaky skin. This is the prototype for leaky eye syndrome, where the blood vessels become weak. They kind of, they're not strong. The barrier is not there. The blood retinal barrier is compromised, and all these fluids leak out and then causes vision loss. The good news is that a lot of these changes, whether it's from high blood pressure, diabetes, and some other conditions which we can talk about, like autoimmune diseases, for example, a lot of these conditions that affect the eyes are reversible if we catch it in time. So the key here is getting it diagnosed early, addressing the underlying issue early, and hopefully regaining vision, causing those the changes in the blood vessels to reverse. One other thing I really want to stress is that, I was saying the eye is a window to your health. We can diagnose over 200 medical conditions based off of an eye exam. Get your annual eye checkup. A lot of people don't realize that, they think, my vision's fine. I don't have any issues. I can see 20/20. So they don't go to the eye doctor regularly. But it should be a part of your annual health maintenance. We go see our primary care doctor once or twice a year. We get our labs done. We get our blood work done. We get our, whether you get mammograms, colonoscopies. You go see the dentist twice a year. Why is it that most people don't go see an eye doctor? So it's really a must, especially after the age of 40, for people to go get an annual dilated eye exam. So not just an eye exam, not just for glasses. I'm talking about a medical checkup for your eyes.
Well, I went not too long ago, maybe six months ago, definitely within the last year. And the ophthalmologist, she said, "Well, your eyes look really good for your age." And I was like, "I don't want them to look good for my age. I want them to look good for a 20-year-old." Like what, and these changes that we expect, like that now is expected to happen. We don't want to be normal. We want to be optimal. What
Yes.
should we ask specifically during the eye exam?
So a couple of things. So you know how when you go to see your doctor, you get a couple of your vital signs checked. You get your blood pressure checked. You get your oxygen levels checked, your heart rate. So when it comes to eye health, one of the most important metrics is your eye pressure. So ask your eye doctor, what's my eye pressure? Is it normal? And having elevated eye pressure, just so people are aware, is a risk factor for glaucoma. And so that's why that's so important to know that. Also, how healthy is your retina? Do you have any signs of retinal issues like early macular degeneration or early diabetic retinopathy? If you're diabetic or pre-diabetic, you should definitely ask that. Early hypertensive changes. And then there are a couple of other retinal issues like retinal tears, detachments. So ask your doctor, is my retina healthy? And then the third thing I would say is ask your doctor, is my optic nerve healthy? Because the optic nerve is the direct connection from the eye to the brain. And so if there's anything going on neurologically, it may show up in the optic nerve. And so ask your doctor, is my optic nerve looking healthy? Do I have any signs of glaucoma? Do I have any signs of any neurologic issues? So I would say those are the kind of the three main things. And of course, you want to know what your vision is. But when it comes to kind of a gauge of your general health, we have to look at some of the other things, not just your vision on the chart, not just whether you can read 20/20 or 20/30 or 20/40. It's much more than that.
Yeah, no, I completely agree. And I think again, the eyes, from sun exposure, the importance, again, this is a big question because I had a patient not too long ago in my office, and she was told she needed to wear sunglasses every time she went outside. And she had terribly low vitamin D levels, hormonal issues, weight loss resistance, all this stuff. I said, you've got to exercise your eyes to the sun to get that sun exposure. So there's this whole sunglasses trend, right? That's like people won't go out without their sunglasses, and then they become really light sensitive versus, the sun is healthy for the eyes. Where do you fall in this spectrum?
It's very controversial, first of all. And I'm going to put on my hat both as an eye doctor, but also as an integrative provider. So I'll give you both sides to this. So it is true that we do need sun exposure because it helps to set our circadian rhythm. It's really important for healthy sleep habits. And it's great for overall health. As you said, it helps to produce, it's important for vitamin D levels, et cetera. So on that end, yes, it's really important to get sun exposure. Now, with one thing I'll just mention, there is this trend also of sun gazing, where people go out and they stare directly at the sun, early morning sunlight, to again set their circadian rhythms and et cetera, their hormones. What I would say is, if you're going to go sun gazing, do it with your eyes closed. Because if you look directly at the sun, even in the early morning, even when the sun is just rising, those rays, those UV rays, are very powerful and they can cause damage to the retina. I've even seen patients who've been sun gazing and they develop what we call solar retinopathy, which is actually a thermal burn to the retina. So don't look directly at the sun. Even if you do it with your eyes closed, those rays will get through your eyelids. They will be detected by the light sensing cells in your retina, and they will help to set your circadian rhythm. So if you're going to sun gaze, eyes closed. That's the first thing.
Or look off to the side of the sun, above or below.
Absolutely. Yes. Not directly at the sun. Kind of like, when you hear if there's an eclipse, don't look directly at the sun. Same thing, because it can do a lot of damage. And so aside from that, overall, I usually tell my patients, wear your sunglasses when the sun is highest in the sky. So in most places, between the time of 10 a.m. to 2 p.m., when the sun is highest in the sky, because those time frames, like those direct rays, can also lead to not just retinal damage, but they can lead to growths on the surface of the eye. Some patients may develop kind of like a pinkish growth. I don't know if you've ever seen a patient with this, Dr. Anna, but
Pterygium.
Pterygium, pinguecula, these are sun-related, these are types of sun-related damage to the surface of the eye. But sometimes people can even develop, and I don't want to scare anyone with this, but burns to their cornea, cataracts, even cancers related to too much sun exposure. So I'm not saying wear your sunglasses all the time, but between those hours, 10 a.m. to 2 p.m. So again, get that early morning sunlight. Don't look directly at the sun. Wear your sunglasses during those periods of the day. I myself, I'm super cautious because I've seen, all the range of things that can happen with sun exposure. So I wear my sunglasses even on cloudy days during those times, like between 2 a.m. to 10 a.m. to 2 p.m. That's my personal choice, but you don't necessarily have to wear them all day long. That's kind of the takeaway message.
And does your eye color matter with those recommendations?
It does. And actually, I had posted a reel on Instagram that did really well about eye color and risks. So if people have lighter eyes, particularly blue eyes, but also hazel eyes or green eyes, they may be at more risk for certain types of eye conditions like macular degeneration and also those types of cancers that I was talking about. We all hear about skin cancers. You can also get cancers on the eyelids or on the eyes or even in the back of the eye. So lighter pigmented eyes have a higher risk for those types of cancers. Then on the other side, people who have darker colored eyes, like brown, various shades of brown, are at higher risk for cataracts and certain types of glaucoma. So there's no eye color that's perfect that will protect you from everything, but just be aware of your risks. And if you do have lighter colored eyes, really be even more cautious about wearing your sunglasses during those times of the day.
I think it's so fascinating. So say we have this exposure, years of exposure like we do on our skin, then those nutrients, foods first, and your book Beyond Carrots. You guys want to make sure you are able to get that book, and Jami can put a link in the chat. But the supplements like the bioflavonoids for the eyes, the eye specific carotenoids, and I want to say astaxanthin, but you didn't give astaxanthin. You said tell me the xanthins again.
Lutein, zeaxanthin, which is with the Z
Zeaxanthin.
actually, and mesozeaxanthin. Those are the ones that are most studied for eye health. Now, let me talk a little bit about astaxanthin because it's a really interesting compound. It's natural compound, and it has a really interesting backstory. So astaxanthin is also a carotenoid, and it is a red pigmented carotenoid. The other carotenoids that I mentioned, they're more like yellowish orange, like the foods that they're found in. But astaxanthin is bright red, and where it came from is millions of years ago, hundreds of millions of years ago, probably, there were these algae that lived in very difficult conditions where they were in the desert. There was very little water. There was a lot of harsh sunlight for thousands and thousands of years. They may not have gotten nutrients. So they had to find a way to protect their DNA. And they developed this carotenoid called astaxanthin, and it protected their DNA from damage in these harsh environmental conditions. Now, other animals, marine animals, ate that algae. And so again, the algae was red. So those marine animals took on that pigment. So when you see marine animals that are reddish pink in color, like for example, flamingos, salmon, various types of shellfish that are reddish pink, it's because they've eaten algae that have astaxanthin. And astaxanthin, again, it protected the algae's DNA, but it is such a potent antioxidant, even for humans. It's considered actually the king of antioxidants, more potent than vitamin C, A, E, glutathione even. So studies have kind of measured its potency in terms of its antioxidant capabilities. Astaxanthin is amazing for skin health. I think that's where it's been most studied. And it's just starting to be studied for eye health. There are a few small studies that show that it can help with macular degeneration, prevention of macular degeneration, when taken in conjunction with the macular carotenoids. So the studies didn't look at astaxanthin by itself. It was with lutein and zeaxanthin. But also other studies have shown that it helps with blood flow to the back of the eye, which is great. And it can also help with reducing inflammation after surgery. So I think this is a really fascinating antioxidant, this natural carotenoid. I think we're going to be learning a lot more about it, not just for eye health, but other health benefits as well. So keep an eye out for it, pun intended.
Yeah, I love it. I use astaxanthin skincare cream, like to give you that natural glow, that sun glow, but plus the antioxidant protection. I use a brand called Nibu Naturals, and it's very much like oil-based, very moisturizing. It's interesting. I'm like, oh, I got to be more regular with that now for sure, as
Yeah.
well as supplementation. And so when we think about these things, have you been able to, with nutrition, supplementation, topicals, reverse macular degeneration, reverse glaucoma, like reverse once you have it, is that it?
So, unfortunately, once a change has happened in the back of the eye, it's very hard to reverse it completely. Like for example, I'll talk about macular degeneration because I know it may be on a lot of people's minds. They maybe have been diagnosed, or maybe they have a friend or family member who's been diagnosed. It's a devastating condition because, or can be, because it affects our central vision. So imagine, you can't see right in the middle. You can see in the periphery, but you can't see in the middle. You can't read properly. You can't see people's faces. You can't see expressions on people's faces. So it can really affect one's life. There are different stages of macular degeneration. So there's early, intermediate, and advanced. So with early disease, if you take well, number one, include the foods in your diet. If you include enough macular carotenoids in your diet, you can reduce your risk of vision loss of progressive vision loss by 43%. 43% reduction with having enough of the macular carotenoids in your diet, which is mind-boggling. I mean,
Amazing.
none of our drugs have that higher rate of reverse or I would say stabilization, not reversal, but stabilization. But you can stabilize. So people with early, absolutely include them in your diet. People with intermediate, include them in your diet, but also take a supplement so it doesn't progress to the end stage where you may actually lose vision. So those are the two things that I always tell my patients. I can't turn back the clock on what's already happened. Like if you have early, you have early. But what we can do is we can do things to stop it, arrest it at its early stage, prevent it from getting worse, and prevent it from affecting your vision. So people with early really don't have any symptoms. Their vision is normal. They go about leading their normal daily lives. They don't even know they have it until they go see their doctor and they're diagnosed with it. So that's the time to intervene. Don't wait until it's gotten to the advanced stages, because once that happens, unfortunately, we can't naturally. I mean, there are medications we can use. You've probably seen advertisements on TV for these drugs that are injections. Nobody wants to get injections in their eyes. They do work for that stage, but the goal is never to let it get to that stage. So that's what I work with my patients on, is teaching them what they need to do, what foods they need to eat, how much of these foods they need to eat, and also ideal supplementation and also lifestyle. Um, One thing I'll share with you, and hopefully everyone on the call here is very health minded, and hopefully no one's smoking, but there have been some studies with macular degeneration looking at smoking. And they actually did a big twin study. So they're identical twins. One twin smoked and the other twin did not smoke. And the twin who smoked had a 2 times risk of developing vision loss from macular degeneration than the one who did not smoke. So we know that smoking, with all of its toxins, propagates this process in the back of the eye. There's inflammation going on, oxidative stress. So as I would say an extension of that, again, hopefully people don't smoke, but other types of toxins, air pollution in particular, that you may be exposed to, try to reduce that. So I know, for example, I'm in New York and our air quality index is horrible right now because there are some forest fires going on up north in Canada. So all that's coming down. So even those types of air pollution you want to reduce your exposure to. So get a good air quality filter in your home. When the air quality is bad outside, keep your windows closed. Do other things to detoxify. You can even use foods to detoxify, like the cruciferous vegetables, for example. So there's a lot people can do to fight against macular degeneration using natural holistic methods. And sorry, that was a long-winded answer to your question, Dr. Anna, but I wanted to get all that out there.
Oh my goodness, this is such good stuff, Dr. Rani. And we've had some questions come in. I want to get to those, but first I want to discuss dry eyes. Also, I'll put links to a couple air purifiers that I really like and use in my home too, that make a difference. Not all air purifiers are created equal, but I have mine running 24/7 on
Yeah.
the floor of my house continuously. And
Yeah,
I
and I'll add something else. If you're someone who suffers from allergies, eye allergies, particularly in the spring or the fall, you need to get an air purifier, and even keep a small version right by your bed on your nightstand, because it is so helpful to help get rid of all those allergens, irritants from the air that may impact your allergies.
Yeah, that's an excellent point. So what's happening with dry eyes? What's causing it? And yeah, what's causing it? What is it? How do we get rid of it? All that.
Yeah. So I'm going to share something with you all that you all need to know, and tell all your friends, particularly all your female friends, about this. Dry eyes, it's the eye is dry, just like we can get dry skin. There's not enough lubrication, but drops are not the answer. They're just a band-aid. A lot of people use just drops to, lubricate, but in reality, we have to figure out what the root cause of the dry eye is. And I'm going to share something with you. Hopefully, you can all see this. So I have this little diagram here. Can you all see this? Okay, so this is a picture of someone's eyelid kind of pulled down like this. So we're looking at the glands inside the eyelid. And these glands, they're called meibomian glands. And it's kind of hard to pronounce, but it was a doctor, Dr. Meibo, I think that was his name, and he named the glands. So anyway, these are oil producing glands that are in our eyelids. And each eyelid has about 25 to 30 glands. And they produce oils that are on the surface layer of your tears, and they prevent the tears from evaporating. So, what many people don't realize is that when people have dry eye, it's not that they're not making enough tears. Most people do actually produce enough tears, but the tears are simply evaporating off the surface of the eye because the oils are not healthy, which goes back to the oil glands are probably not healthy. And so to counteract dry eye at its root cause, and about 85% of people with dry eye have this problem as their root cause. Their glands are either not functioning properly, meaning that they're not producing enough healthy oils, or they are structurally damaged. So this is a camera that I use in my office. It's an infrared camera to look at the glands. So this is a healthy person's eyelid. Now I'm going to show you what somebody with gland loss looks like. So you can see here, the glands are okay. They're maybe a little bit thicker, like a little disorganized, but here you can see some focal gland loss. And on the inside here, there's some early gland loss starting as well. So this can happen. And if this happens, this is called meibomian gland atrophy. And this, unfortunately, is irreversible. Our glands, we only have one set when we're born. And basically, if you lose them, you can't regrow them. It's not like your skin or your liver where it can regrow. They're gone. So we need to keep our glands healthy. So this is somebody who has a little bit of gland loss. I would say maybe like 30% gland loss. Now, this bottom picture here is someone with severe gland loss. This is actually somebody with autoimmune disease, particularly rheumatoid arthritis and Sjogren's disease. And so what can happen is the glands can get damaged. And again, once they're lost, you can see there's like barely just some stubs of glands left here. These are like on the verge of dying off. This is about 85% gland loss. And again, once somebody gets to this stage, we can't bring the glands back. We can put on, drops that have oils on them, but those oils will probably not be enough as our natural oil. So the goal is, again, prevention. You want to stay in this range. Even if you get to this range, you're still probably doing okay, but you need to keep the glands healthy. And there's a couple of ways to do that.
Well, before you go, and for those who are listening, the first image is like, just beautiful straight across, looks like
Yeah.
beautiful glandular folds all the way across. In the second image, looks like missing teeth, right? Like you've got some teeth
Yes.
out in
There are
this
gaps.
image, right? There are gaps. And in the third image, it looks like it's completely rubbed raw. Like those glands are just missing, the teeth have fallen out, so to speak, and you're just completely missing. And I will have to tell you, Dr. Rani, I don't think I've ever had an ophthalmologist comment on my glands, whether they didn't look or did look.
Ah.
Now I'm like, that's a fourth
Come
question.
see
Got to make
me.
sure. I'm coming. I'm
When
coming.
you're
I'll
in New
be in New
York,
York, yeah, soon.
come
But
see me. I'll do your gland. So many eye doctors do have the device, the camera imaging system. Some don't. So I think you just have to ask for it. I tend to do this on all my patients for baseline. And the interesting thing is, well, before I get to that, let me share a little bit about these glands. So these glands, you're going to find this really interesting. They have receptors, sex hormone receptors. And you would think that they have mainly estrogen or progesterone receptors. The reality is that the majority of the receptors are androgen receptors on these glands. And so what happens in midlife, both for women, but also for men, is that their hormone levels decline. And again, it's not just estrogen and progesterone, but it's also testosterone. They decline and the glands start to atrophy. So this is something that I commonly see in my patients who are in midlife with hormonal issues. And this again is more, it's beyond that. This is more like autoimmune in nature, but this is something very, very common that I see. And so it is important to think about hormone support for your eyes. Now, there have been some studies looking at hormone replacement for dry eye and to support the glands and prevent dry eye. Unfortunately, when the traditional HRT was used in these clinical trials, it really didn't help. And in actuality, some patients actually got worse, and because they were just given estrogen and progesterone, they weren't given the androgen. So it is really my belief, and from my practice and what I've seen with so many hundreds and probably thousands of women at this point, is that we need to supply them with the full hormone spectrum. So what I do is I actually do compounded hormone topical creams that I prescribe for my patients. So that's kind of the strategy that I use, again, from a functional medicine integrative standpoint, on top of the medical aspect of things. So I try to bring everything together.
Yeah, that makes sense. And you use a topical DHEA, and you said, okay, this is key to really
It
help. And
is
I have to
key.
say that I started using, because I'd stopped wearing contacts because of dry eyes, right? Like, and
Hmm.
and also not just going out as much or not caring, but maybe because of the dry eyes. So I started using in my Jolva small formula on my eyes after I spoke with you, and I've noticed
Yeah,
increased difference. And I wore my contacts again a few times, and they didn't bother me. They didn't bother me
that's
at all.
amazing.
So I
That
was
is
like, so you
phenomenal.
can
Yeah.
quickly get, but it's not growing new glands. It's just supporting the ones that
It's
are there.
supporting the glands that are structurally intact and functioning well. The other thing that supports the glands are omegas. Now, we've all heard about the omegas and their health benefits, heart health, et cetera, brain health, but eye health is an oftentimes underrated aspect or positive aspect of these omegas. And I'll share this also with you. It's not just omega 3s. Studies have shown that we need not just DHA, EPA for our glands. We also need GLA, which is gamma linolenic acid. It's an anti-inflammatory omega 6, and omega 7 and omega 9. So I always recommend, if someone's taking omegas for their heart health or something else, and they also have dry eye, I tell them to switch to a complete full spectrum omega. I actually have one. I have a product line. So this is the one that I have. It's called Soothe. I don't know if you could read that there. But this is a full spectrum omega that I formulated for eye health. But again, there are many things you can do to keep your glands healthy. I actually have a eye care routine I can share with you
Please
that
do.
also help
Please
to
do.
support
We're all
support
listening.
yeah. So the omega is kind of the foundation, but also for, just like you take care of your teeth. I'll play upon Dr. Anna's tooth analogy here. We brush our teeth, we floss our teeth, and sometimes we use some kind of a rinse. So there is a three-part strategy to eyelid hygiene, especially if you wear makeup like eyeliner, mascara. Number one, take the makeup off. But this is even more important if you wear a lot of eye makeup. This three-part strategy. So number
Oh,
one,
let's go beyond that. Fake eyelashes, right? Like
okay.
that glue cannot be good. I need to record this to have my daughter listen.
Yes, I'll share something. Like, I don't wear any eye makeup whatsoever because I've seen what can happen, and I choose not to. And I tell people, if you're going for a special occasion, sure, you can wear your eyeliner. You can do tight lining as a no-no because that can also block the glands and ruin the glands. But if you're going for a special occasion, it's fine. Eyelashes, that glue most glues have formaldehyde, and it can really irritate not just the skin, but the lash follicle. And there are so many people, unfortunately, who've actually had permanent lash loss from using that glue because it's basically killing off your eyelash follicle, which is right here. So just be aware of it. I prefer magnetic lashes, which is basically, it's not a glue. It's like a eyeliner that has some it's magnetized in some way, and then you just pop the lashes right on, and then you remove the eyeliner when you're done with it. I much prefer that over the glue.
Okay, well, I'm gonna have to try that one. Did I do damage when I did my eyeliner tattoo?
So no, No,
Oh, thank goodness.
because
I'm like,
that
because I didn't
is
even think about
so,
my eye glands. That was all
yeah.
vanity.
Yeah, I don't think you can see it on the picture, but I'll try to just, I don't want to come too close and show you this, but if you look in the mirror and you pull down your eyelid, you'll see these tiny little dots on the inside of your lashes. Those are the openings of the glands. So if you look really closely, pull down your lid, and you see those little white dots, not where the lashes are, inside of that. That is your waterline. And that's where the gland openings are. They look like little, do you see them, Dr. Anna? Yeah. Oh, I think you're muted. Yeah. So you,
Yeah, I see them. I'm
when you
looking with my
wear,
camera right now. I'm going to take a picture. I'm going to text it to you.
okay. So when you wear your eye makeup, please do not block those glands. That's called tight lining. And you are directly putting a mechanical barrier on those glands and they're not able to release oils. So why would you do that? So if you're wearing eyeliner, you want to put it on the outside of those glands. So that's perfectly fine. And that's where the tattoos typically are. They're on the outside. And the same thing on the upper eyelid. Most people probably don't wear eyeliner like directly on their waterline, but you just have to be mindful of your mascara. If you're wearing mascara, is try not to block those glands. So Preeti is saying lots of South Asians line their waterline. Yes, that's a no-no, unfortunately, Preeti. Like I know a lot of people use kohl, Kohl.
Yep.
That is a no-no practice.
Yeah, I use that a lot.
Yeah, so just wear it on the outside, not on the inside. Another trend I've seen recently is people using a white eyeliner. Have you seen that? I don't know what it's
Yeah.
called. It must
Or
have a name to it.
silver or yeah.
What is it called?
No, but there's also a silver, but I've seen the white definitely.
It makes me cringe because I'm realizing that the glands are not able to secrete oils. And if, I'm sure people are suffering with dry eye, but they're not connecting the two, right? That their eye makeup practices are probably impacting their dry eye. But getting back to the eyelid routine, um, 3 steps. Number one, you want to use a high quality moist compress. So not just like a little washcloth run under hot water. That is not going to retain the heat. You want something that's going to retain heat for about 5 to 10 minutes. And so you can use this. This is, I'll show you what it looks like. This is my favorite brand. It's been around for years and years, and a lot of eye doctors use this. So this is called the Bruder Eye Mask. And it has, if you can hear, if you hear that kind of scratching, I don't know if you can hear that. It's got moisture beads inside. So they're patented. What they do is you put this in the microwave for about 10-15 seconds, not minutes, seconds, heat it up, and it retains the heat for about 10-15 minutes. And then you don't want to put it directly on your eyes because it's white on the back. So you want to just put like a tissue or a little cloth there and then heat up your glands. Number one, heat the glands. If you don't want to use this, or if you don't, let's say you don't have a microwave, what you can do is you can put it in a steamer, just a regular steamer on the stove. You don't want to get it wet, but just so it gets hot, and then you can use it that way. Or if you don't want to use this, you can also, this may sound a little odd, but get a hot potato. So take a small to medium sized potato, heat it up, wrap it in a wet washcloth, and put that on your eye or both eyes. And that will provide prolonged heat. So again, washcloth is a no-no, a wet Q-tip is a no-no. That does nothing, really nothing. You need to do the heat for longer. That's step number one. So once you've heated up the glands, you're going to just gently massage downwards. Not press on your eye, but just gently. What you're trying to do is, if there's any blockage in any of these glands, you're trying to express out any blockage there. So gently massage down. And then on the bottom lid, you want to kind of massage upwards a little bit just to get those oils flowing. And then what I recommend is, I have all my show and tell here. These eyelid cleansing wipes. It's from the same company, Bruder. And this is basically, it's a pre-moistened kind of a pad here, and it's pH balanced for the eye. And so basically, once you've done your little massage, you wipe it off, and then you can toss this. You can use it on both eyes and toss it. And then the last thing, the third part of this eyelid hygiene routine, is a hypochlorous acid spray. So many people have probably heard of hypochlorous acid. It's great for skin health, etc. This is something, it's a mist. You just kind of spray it and then let it dry. And this is supporting the ocular surface microbiome. We have a gut microbiome, we have a skin microbiome, we even have an ocular surface microbiome. And sometimes that gets a little bit off balance. So that supports that. So I know it was a lot of information, but
Oh, that's so good. That's so good. I'm thinking, okay, my eyes have been neglected in this way, right? We think of oral health. I'm always talking about vaginal health. Same thing. We want to improve glandular secretion there and the microbiome. So same with eye health, right? We don't think about it. At least I haven't
exactly.
really
Yeah.
given it a lot of thought other than sun exposure or light exposure and screen time and blue light blockers and those things that we've talked about here. But the eye microbiome, so the hydrous chloride, is
Yes,
it?
this is 0.02% hypochlorous acid. And basically, it's antimicrobial. And it really gets rid of some of the unhealthy bacteria that can build up on our eyelids, that can get into our eyes. So, again, especially if you're an eye makeup user, you want to do this routine. Support your glands with the heat, do a little massage, cleanse with a wipe, clean it off. And if you have a lot of inflammation around your lids, you may even want to use, I don't know if I have it here, I may have it here. There's another formulation of this with tea tree oil. And so tea tree oil is melaleuca oil, and it can really help to decrease inflammation of your eyes. The last time I checked, this was out of stock. I used to have it in my online store, but now it's out of stock. So it may be back in stock now. I'm not sure. But basically, the regular wipes are fine for most people. But if you have a lot of inflammation, you may want to consider the tea tree oil. One other thing I want to mention is that you may have also seen commercials on TV about eyelid mites. Has anyone seen that commercial? Okay. They look kind of, you know, not pleasant, but these are parasites that most of us have, and they live inside the lash follicle. And most of the time, they're not a problem. As people get older, it's almost like 95% of people have them by the time they're in their late 80s, 90s. So they're very, very common. The problem is when they overgrow, they secrete a lot of, they basically eat debris, and then they secrete their excrement ends up at the base of the lashes. So if you have a lot of like dandruffy like material on your eyelids, or if you wake up with like crusting of your eyes, you may have an overgrowth of these eyelid mites. And yes, there is this prescription medicine that was just FDA approved, and that's what they're advertising on TV. It's extremely expensive. It's called Xdemvy, Xdemvy. You can use it, but actually, the tea tree oil is great. So, as an alternative to the prescription medicine, the wipes with the tea tree oil, again, this is the one it's got it's got green on it for the tea tree oil. The tea tree oil, it's very dilute tea tree oil. So don't do like if you're making like a home remedy, you definitely want to dilute it down to less than 5% melaleuca oil. But you can use it like on a little cleanser pad, and then you can wipe your eyelids. And that also helps to control the mite infestation.
Oh, wow. So fascinating. Good to know. We have had so many questions come in, and I want to kind of rapid fire them at you. And so one of the things, what do you do about floaters?
So floaters are a natural part of aging. And let me pull out my eye model here to show you. So here's our eye. And when we look at someone's eye, we just look at the very front part here. But there's actually a lot going on the inside. So if we open it up, see there's so many structures inside. And I won't go through them all, but this here it's plastic in the model, but this represents the jelly that's on the inside of the eye. It's called the vitreous jelly. And when we're young, this is kind of more gel-like, kind of like jello, like more firm. And as we get older, it breaks down into liquid. Now, the jelly is mainly made out of water, but there's also collagen in here. And when it breaks down into liquid, the collagen particles float around and we see them as floaters. So that's what floaters are. They are pieces of collagen. Sometimes they look like lines or dots or squiggles. You may notice them more like if you look up at a white wall or at the blue sky, you may notice these little things floating in your vision. That's what a floater is. And in most cases, it's benign and it will eventually settle down with gravity. So typically, I do not recommend anything for these floaters. There are some eye doctors out there who would recommend doing a laser, which basically breaks a single floater up into tiny little, hundreds of little floaters, which I don't recommend, or doing a surgery to remove the jelly, remove the entire jelly to remove everything, which I don't recommend because it's too risky. So I recommend just waiting it out. There is some data to show that bromelain, which is an extract, it's an enzyme that's extracted from pineapple, can help to reduce floaters. So there's some early studies that show that bromelain may help. If you're going to eat pineapple, you have to eat a lot of it, basically. You have to eat like half a cup a day for months and months and months to see the benefits, or you can consider taking like a bromelain supplement to see if that will help to reduce your floaters. But the main thing is if you have floaters, don't worry. It's part of, the change inside your eye. Usually it's benign and usually it will pass.
Well, and I did put bromelain because it helps with so many things into Mighty Maca, but you really need a higher dose for the eyes. So there is some in there. Now, question about Caroline had written in and asked if she has high blood pressure, can ginkgo biloba help with the oxygen circulation in the eyes?
So I don't think there's been any work specifically with ginkgo and oxygen circulation. We know that it may be protective against glaucoma. There's some studies looking at that. Rather than ginkgo, I would turn to astaxanthin.
Astaxanthin, yeah.
That's the one that's been shown to help improve blood flow and oxygen.
And with the hormone creams you prescribe, where do you apply them? Upper eyelid and lower eyelid?
Yes. And again, not inside the eye, not even on the waterline, but just below the lashes. Kind of, you don't want to get it inside the eye because it's not pH balanced for the eye. So just on the bottom, upper and lower, and then you go to sleep.
Okay, excellent. And what about like as far as do you have a brand of the magnetic eyelash thing that you like? Is there a brand that you know of?
Yes, and I'm blanking on the name. It was a fellow ophthalmologist who created them because she saw all the complications from the false eyelashes. I'm blanking on the name of it. I can send it to you. Yeah.
Yeah, definitely. And we'll put it in the show notes. And any makeup remover, specific things you need to like look for in an eye makeup remover, like or to avoid as far as eye makeup remover, or soap and
Um,
water good enough? That's like my go-to. And the question about castor oil packs, like I have castor oil night mask, but could we use that and apply heat to it? Like apply your
sure.
mask over it.
Sure. So in terms of eye makeup removers, again, I don't wear eye makeup, so I couldn't really advise you on that one. But from my colleagues, micellar water, that tends to be like a popular ingredient, or you can just use one of the wipes because the wipes work in that same way. So it helps to support your glands or clean away debris, clean off the makeup. In terms of castor oil, I'm going to share this with you. So my father-in-law has dry eye, and he said, "Rani, can I got this online. Can you check to make sure it's okay for me to use?" And what it was is castor oil eye drops. It was in a dropper bottle. He got it on Amazon. He said it was organic. He said it was from a trusted source. And I said, "Dad, please do not put castor oil inside your eye." And he's like, "No, no, but I saw somebody on YouTube doing it." And I said, "Don't put it inside your eye because you don't know if it's
An
sterile,
irritate. Yeah.
it could be contaminated." But when it comes to the packs, if you use them externally, they can definitely help. I mean, I'm not sure how long they stay hot. But if they provide enough duration of heat, you can use them. The other benefit is that castor oil has actually been shown to grow eyelashes and eyebrows.
I'm
So,
game. I'm like, I'm gonna start using it, but then use
yeah.
the brooder, heat up the brooder pack and put it over our castor oil packs.
You could do that. Yeah. Yeah,
That's like
absolutely.
double. And do you do this eye routine every day?
I do it once a day, yes. And I prefer to do it at night, but you can do it whenever. Like if it's easier for you to do it in the morning, you can do it in the morning. For my patients who have really severe dry eye, I recommend that they do the hot compresses twice a day for really severe
Okay.
dry
For
eye.
severe dry eyes. And then
Yeah.
what about eye drops with vitamin A in it?
So I've tried that on quite a few patients, compounded, and because you can't just they don't make them. There is no commercially available product with vitamin A in it as a drop formulation. The issue is that it's pretty even in dilute concentrations it really burns, and a lot of patients, they're using product for dry eye, they want to feel better, they want to feel more comfortable, but then they're putting something in their eye that's really burning them. So I kind of steered away from that. There's another compound that I like. Again, this is a compounded drop. You would need to get a prescription from your eye doctor, which is acetylcysteine
Mhm.
and NAC basically, but in a drop form. So that is something that some of my patients have really benefited from, particularly people who have autoimmune causes of dry eye, like rheumatoid arthritis related or Sjogren's disease related. And they feel a lot of benefit from that. So, like 10% acetylcysteine drops compounded.
10%. Okay. There's so much good information here, and I appreciate it. This has definitely been an excellent topic to go into. So, Dr. Rani, will you please tell our audience how they can get a hold of you and get your book? And we'll put all these links below too.
Absolutely. So my website, it's drranibanik.com, is you could get all my resources there, links to my books, and then also they're on Amazon, by the way, and my shop, which has these products in it. And then if you want to follow me for more tips, I'm on Instagram and YouTube. So on Instagram, it's dr.ranibanik, and YouTube is my full name. So
Thank
me
you.
there.
One last question. Watery eyes. When someone is really struggling with watery eyes, is that a symptom of dry eyes?
It is. And it may seem contradictory. Like, if I have dry eyes, and why do they constantly tear and why is it coming down my cheeks? Well, the reason is because if your eyes are dry, what happens is the tear glands, not the meibomian glands, we have separate lacrimal glands that are up here in our eye socket, like just under the bone right here. They kick in, they get a signal, oh, the eye's dry, make more tears. So they make more tears, and that's why people oftentimes have watery eyes, but the tears don't stay, they evaporate if the glands are not working properly. So, yes, people with dry eye can have watering, but if you fix the dry eye at its root cause, the watering goes away.
Yeah, yeah, perfect. And the fact that we can reverse these things, do something about it, have healthier eyes is key. Okay, I said last question, but another question popped up that about the pterygium. Once you have pterygiums, can they be reversed or removed?
So it's like scar tissue basically on the surface of the eye. It's benign, but cosmetically, a lot of people are bothered by it. It tends to grow like a little triangle on the inside of the eye. It needs to be removed surgically. Like, there's no magic drop that will make it dissolve and go away. It's literally like a scar on the surface, but we can completely remove it. And we also do, as part of the procedure, we do a little extra part of the procedure to prevent it from growing back. Because oftentimes, if you don't do those extra steps, it does grow back, and it grows back even worse.
Yeah.
So talk to your doctor about if you want to have pterygium surgery, like what's the best way to prevent it from growing back.
Yeah, so much good information. Okay, and you talk about a lot of this in your book. So your book
A lot
would
of
be
it's
good.
in there. Yeah, a lot of the topics we touched on: high blood pressure, diabetes, macular degeneration, glaucoma, we didn't talk that much about cataracts, but it's all in the book. And lots of food.
Awesome.
So if you don't like any of these foods, there's lots of options out there. You can always find something to support your eyes with.
Yeah, well, thank you so much. And then also they can visit you in New York and be a patient.
Absolutely. Yeah.
Yeah, thank you
Yeah.
so much for being here and thank you for all your time today. And I so appreciate it. When it comes to eyes being the window of our soul, we want it to reflect the most, genuine, healthy, authentic self that we have. And to know that we can help with, and eyes are, I mean, critical, right? One of the limiters as we get older is poor, to quality of life is poor eye health, poor vision, issues with our eyes, requiring surgeries, et cetera. And if we can reverse that and never, need that, that's even better. And to know that we can, you've given us a lot of hope today. So, and a lot of good information from the foods, from the nutrients to the hormones to the procedures to the eye hygiene. I am committing me and and our listeners to do this eye hygiene protocol and not take it for granted. I mean,
Yes, please. I mean, that's the message I want people to go away with. And first of all, thank you so much for having me on. As you can see, I'm really passionate about this, and I love just spreading this information because people are not aware. Most doctors don't talk about it. Even most eye doctors don't talk about prevention. Like if you go to your doctor, you probably get maybe 10 minutes face to face with your doctor. Most of the time they're checking your glasses prescription. Like that's not what it's about. It's about longevity of vision and I really appreciate, this opportunity.
Thank you, Rani. I appreciate it.
You're welcome. Take care, everyone. Bye-bye.
Bye. Well, I hope you loved this conversation with Dr. Rani as much as I did. And we in our community really loved it. I got so many raving positive feedback from our Girlfriend Doctor Club community. And they're like, okay, they want to share this episode. So I promised I'd make it into this podcast to share with all of you as well, so they can share it as well. Listen, big reminder that you are not alone on this journey. And if today's episode spoke with you, share it with a friend who needs this encouragement, and be sure to connect with Dr. Rani for more wisdom, tools, and support in your own health journey. Be sure that you do adapt some of these, if not all, of the healthy recommendations to maintain our eye health that we discussed during this episode. Just so much wisdom and so much possibility and insight we really gained. And she knows because she is the ophthalmologist, one of the best. So really, I've been so grateful for these practical tips. I want to thank you so much for being part of this community. Remember, you are made for connection, for joy, and for vitality. So stay well and stay empowered. It's always about looking at those underlying you may be experiencing symptoms, putting your Nancy Drew detective hat on and taking one next right step. Well, please like, share, and subscribe to my podcast wherever you listen. And I thank you for being here. I love being your girlfriend doctor. Till next time, God bless.
Thanks for watching another episode of the Girlfriend Doctor podcast. Check out all the links below for more.